Hey guys, welcome back to Loop Hub. Today we'll talk about the most disgusting Dr. Pimple Popper moments that made us shudder. Let's head into it. Number 1. 5-pound fat mass. Dr. Pimple Popper went on a bursting spree in her holiday-themed TLC special to cap off the year of both in-person treatments and internet consultations. Owing to the coronavirus pandemic, Dr. Pimple Popper's season Squeezings, which launched at 9 PM Monday, included some lipoma, cyst, and blackhead action, as prior videos and television episodes of Dr. Pimple Popper, but with a seasonal twist. Dr. P treated 7 patients with a variety of skin issues such as lipomas and cysts during the hour-long episode. Marilyn, 76, had a 5-pound grapefruit-sized lipoma, or fat-filled mass, and her treatment was perhaps her most eye-catching. A lipoma is a fat-filled growth that develops between the muscle layer and the skin layer of a person. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches. A lipoma is usually not cancerous, but if it hurts or irritates the person who has it, a dermatologist can remove it. Marilyn said she generally holds Christmas celebrations at her home, but she hasn't in recent years due to the weight of the mass on her arm, which has been growing for 15 years. Dr. P had Marilyn lie on her side, with her lipoma-bearing arm facing the ceiling to remove the lipomas. Then Lee injected a numbing medication into it so Marilyn wouldn't feel the cut and pressure. The present moment when Dr. Pimple Popper cut through the lipoma center, a big lumpy yellow fat deposit emerged. It was so big that Lee compared it to Marilyn's 9th kid. Dr. Pimple Popper was able to cut most of the fat to the surface of the wound with her hands and scissors. Small parts, however, remained wedged under Marilyn's skin, requiring a little additional probing and chopping. It's been stuffed in there all comfy for a while, Lee remarked as she sliced away excess fat from the lipoma to allow her hand to pass through the incision. It'll take some effort on my part, but it'll be worthwhile. Dr. Pimple Popper patched Marilyn's arm and sent her on her way to complete the therapy. Marilyn told Lee tearfully that she was looking forward to wearing short-sleeve shirts again and taking care of her family for Christmas. Number 2. Acute cyst. Dr. P has been able to see patients in her California office despite the pandemic, and she has the nasty pimple popping videos to prove it. Dr. Sandra Lee published a YouTube video on November 30 in which she removed the contents of a man's pillar cyst. A pillar cyst is a hard flesh-colored skin lump that's filled with keratin protein that's accumulated beneath the surface. These pimples are usually harmless, but they can cause pain in certain people and require surgery to remove. The growth on Lee's patient's temple along his hairline reminded him of a tooth, and Lee herself described it as cute due to its compact size. Dr. Pimple Popper used a surgical blade to make a small incision around the cyst to remove it. Lee explained in the video that she made the incision as little as possible to reduce scarring once the area healed. Lee used a small hook tool and scissors to gently open the incision and gain a closer look at the cyst insides after injecting the patient with a numbing medication. She then removed the entire pebble-sized growth of the man's skin with scissors. The patient was bleeding where Lee made the incision after the cyst was removed, so she used a small cauterizing pen to stop blood flow from the tiny blood arteries inside. Dr. P then closed the wound with several stitches and allowed it to recover. Number 3. 1. Dr. Pimple Popper has already blessed her followers with new acne material to get them through the year ahead. It's only a few days into 2021, and she's already blessed her fans with the new acne content to get them through the year ahead. The dermatologist removed a woman's cheek cyst and assisted a man in finding a doctor to remove his unique and huge neck growth for the season 5 premiere. Juan, a 32-year-old from Texas, was also helped by Dr. P, who had golf ball-sized boils all over his body. Juan first noticed the bumps when he was 13 years old, and they grew in number and size over time, leading to him being ridiculed at school and eventually quitting out. Juan stated that he had consulted several doctors for his problem, but that many of them were reluctant to touch him after seeing the magnitude of his growths. Juan's growths were drained by others, but they grew again a few months later. Juan wore his hair long to disguise the large bumps on his neck as a coping mechanism. Despite this, Juan described the growths as painful at times, like a softball attempting to escape through a pinhole. Dr. P said she could remove Juan's largest cysts, or fat-filled growths, but she couldn't guarantee they wouldn't come back because he had a lot of scar tissue, which promotes cyst growths, according to Lee. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.